Can you please comment on the evaluation and management of nephritis in patients with metastatic renal cell carcinoma who are receiving checkpoint inhibitor therapy? Nephritis is chronic inflammation, and it can be the kidney tubules and the tissues become inflamed, which leads to kidney damage. And in patients with kidney cancer who've already had a partial or radical nephrectomy, they're predisposed to worsening chronic kidney disease and at risk for nephritis simply because they have less renal function. Partial or radical nephrectomy can increase this risk, as well as those drugs which are nephrotoxic, which would include furosemide, the thiazide diuretics, triamterene, allopurinol, omeprazole, and antibiotics, including penicillin, ampicillin, and sulfonamide medications. So being aware of concomitant medications is helpful to minimize and manage potential nephritis in patients that are receiving immunotherapy. Patients may present with decreased urine output or darker, more concentrated urine. That may be something that patients will call and say, my urine is really dark. So that would be something that you'd want to evaluate. It's also important to assess and ask the patient if their urine is foamy or bubbly, because that is a clinical presentation for proteinuria. And it is more common to experience proteinuria in the kidney cancer patient population, again, because they have decreased renal function at baseline. So those are key things that you want to be aware of. Now, what do you do and how do you monitor and assess that? So notification and making sure the patient is aware to call if they notice either decreased urine output or darker color for the urine, bubbles or foam, or hematuria. So any of those changes should alert the clinician to evaluate that further. And that would include testing of a comprehensive metabolic panel, or at least a basic metabolic panel, as well as a routine urinalysis, which will show you the osmolality, the color, and a random protein evaluation. It may be that you need to do a 24-hour urine for creatinine and or protein to further evaluate that. And so making sure that patients have access to that equipment and the collection materials if that testing would be appropriate. Treatment then, number one, as with all of our immune-related side effects, is to hold the immunotherapy. The appropriate option, if needed, is oral steroids with frequent monitoring of both blood chemistry and urinalysis testing. You may need to increase the oral prednisone if there's no improvement in the lab results within a week. And patients may also need a nephrology consult, because again, we really need to utilize our experts to help us manage and proactively and early in the course of the immune-related side effects, really get on top of things. So knowing who our colleagues are in other departments and specialties is really key to helping manage not only nephritis with immunotherapies, but the other immune-related adverse events as well.